Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a fascinating and different kind of show for you tonight. We're talking about training tomorrow's medical professionals. From nurses to medical students to residents to fellows, St. Luke's University Health Network is planning for the future by continuing their tradition of training the next generation of people that'll keep all of us healthy. We're going to be joined by a panel of professionals in the field, hearing from the people who develop the programs and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at how St. Luke's is training tomorrow's doctors. Stay tuned. Thanks for being with us. Let's get started. We have a panel of wonderful guests joining us tonight. Meet J.P. Orlando, the Associate Chief Academic Officer at St. Luke's University Health Network. Earning his Doctor of Education degree in Corporate Learning Leadership from the University of Pennsylvania and his Master's in Education in Adult and Organizational Development from Temple University, Dr. Orlando also serves as an adjunct professor at Moravian College and the University of Pennsylvania.
My name is J.P. Orlando, and I serve as the Associate Chief Academic Officer here at St. Luke's. St. Luke's was able to create the first medical school in the Lehigh Valley because it's a 1+3 program. So the first year you'd go down to Temple in Philadelphia, and then your second, third year you'd be up here getting all your anatomy classes and doing all your clerkships and those type of things. Where you train matters. Where you train matters for your patients, where you train matters for your profession and for the community as a whole. One of the things that's interesting about working in a place like this is that you are working in a place, in a community that you live in. Right? So I think from an employee perspective, there's much more buy-in to making sure that things go correctly, that you go the extra mile just from an employee perspective, because you know that at the end of the day, something that you do in the ER to improve patient engagement, patient satisfaction actually translates to, your neighbor when you're seeing them at a community picnic.
JP, thank you so much for being here.
Yeah. Thanks.
St. Luke's has a huge, long history of training nurses and physicians, over 145 years. Tell me a little bit about the programs available and, who takes part in them.
Yeah. So, we started back with the nursing school. We were the first nursing school in the country. And I think that kind of set a great foundation for this organization, for St. Luke's to grow and blossom. That over the years we got started residency programs in internal medicine and surgery back in the 40s, 50s. And again, that created a great foundation for the growth that we've had and to support that
teaching is
growth.
almost really in the fiber interwoven into the way the hospital runs.
Yes, it's very much into the culture of the place and how things operate and how people connect with one another. And, just for an example, whenever we have, rollouts within the network, there's always a piece there on medical education. There's always a piece there on, nursing education. There's a piece on, how does this impact education within the institution? And so that's really been powerful.
And to make sure that it's in part of everything that you do.
Yes.
All right, good.
Absolutely.
We're going to get into that a little bit more in just a few minutes.
Oh, that's awesome. Good.
All right, joining our panel next is Dr. Andrew Goodbread. Dr. Goodbread has been a part of the St. Luke's family for many years. He shadowed at St. Luke's as an undergraduate at Moravian College. He completed his clinical rotations at St. Luke's while at Temple University School of Medicine, and then he finished his residency in family medicine at St. Luke's. Now he's transitioning from his role as a faculty member to his role as Associate Program Director at St. Luke's Family Medicine Residency at the Anderson campus. Dr. Goodbread enjoys sharing his love of the outdoors with his wife and 3 young sons.
I'm Dr. Andy Goodbread. I'm the Associate Program Director of the St. Luke's Family Medicine Residency at the Anderson campus. I first became interested in medicine as an athlete in school. Having the opportunity to go to undergrad at Moravian, then stay at Temple, and then stay for my training at St. Luke's really allowed me to get progressively more invested in the community. And the more I learned about it, the more clear it was to myself and my wife and our now 3 little boys that this is somewhere we wanted to come and stay. Even though everybody's coming to St. Luke's and coming to medicine from a different place, both geographically and potentially in terms of the things that are important to them, the culture at St. Luke's leads to people all working towards the same end goal, which is really good patient care. It's extremely rewarding to take care of patients because you have the opportunity to hear them talk about things that they don't talk to other people about, to be with them through some of the most challenging parts of their lives. And the trust that they give you, the opportunity that you have to use what you've learned to help them through that challenging part of their life is the most rewarding thing. Aside from being a dad, is probably the most rewarding thing I've ever experienced.
Dr. Goodbread, thank you so much for joining us. Having been a resident at St. Luke's and now seeing this program expand, can you explain to us why this is so important in the future of the hospital?
Certainly. So I think most importantly is that we see each community that we serve has different needs. And what we found is that the community that the Anderson campus serves is in need of new programming and certainly new physicians to serve that community. So by expanding the number of physicians that we can train, we can better serve that community, also expanding the number of physicians that we're training in the network.
It's really an interesting way to look at it because St. Luke's answers the needs of the community, but not just the whole community, the communities they serve, which are different. So do you see that what the needs are, say, in Bethlehem is different than what you might need in Easton versus somewhere else?
Absolutely. This area is very interesting in that regard, that we're not just one mega city. We have these three smaller cities that make up the Lehigh Valley. And I think that you'd find that the community of Allentown versus the community of Bethlehem is very different from the needs of Easton.
And this residency program expansion is actually answering those needs specific to the region that it's in.
Absolutely.
Oh, that's exciting. That's really good to know. All right, let's meet our next and final panelist, Dr. Heather Crossa. Originally from Brick, New Jersey, she's a graduate of Lake Erie College of Osteopathic Medicine. Dr. Crossa completed her residency in internal medicine at St. Luke's and is currently working on her fellowship in geriatric medicine. She chose to continue her training at St. Luke's because of the excellent learning opportunities and community engagement. Dr. Crossa will be joining the St. Luke's team of physicians upon the completion of her fellowship later this year.
My name is Heather Crossa, and I'm an osteopathic physician. I'm a fellow in geriatric medicine. I did my medical residency, my internal medicine residency here at St. Luke's. I chose it because when I went on my interview tours, St. Luke's was the place where you walked in and you really just felt like you were home. During residency, you have opportunities to learn from a lot of different people. You obviously learn from each other, being the residents. You learn from the other fellows in the network and all of the subspecialists. I think St. Luke's is really unique in our health network because we expand to smaller communities and we make sure that we have all the subspecialties branching to every area in the community. I love St. Luke's because they always put our patients first. The staff, everybody works together as a team, and we do whatever we have to do to make sure that our patients are safe, that they're well taken care of, and everybody at St. Luke's goes the extra mile.
Dr. Crossa, thank you so much for being here.
Thank you for having me.
So you have completed your residency and now you're in your fellowship in geriatric medicine. How would you describe your experience for everyone out there being a resident and now a fellow at St. Luke's?
Amazing. The first day of residency is definitely one of the scariest days of your life because you're done with medical school and all of a sudden you start and you're a doctor. You're helping people make the most important decisions they've ever made in their life. Thought it would be super nerve-wracking, but being at St. Luke's, everybody's so supportive. Everybody's hands-on. They're very engaged with you and you're in like the best learning institute that you could possibly be. So you're doing everything you can for your patients and you have an amazing team of physicians, nurses, and everybody else behind you. So
it sounds like it's a very collaborative environment and that's a huge reason for you wanting to stay on and continue your career with St. Luke's. We've got a good basic understanding of what graduate medical education is at St. Luke's, but we are not done. Coming up, we're going to dig deeper into the why behind the expansion of medical training opportunities and how they positively affect you. Stay tuned, we'll be back after a short break. You're watching St. Luke's Health Now.
I think the medical school has brought to this campus a certain enthusiasm, a certain sense of accomplishment, and it challenges our physicians, our established physicians who have graduated from residency programs and are now practicing medicine. So you bring these young people in who are learning, who are hungry to learn, and they ask questions, and they don't ask and say no, they say, well, tell me about this or tell me about that, and why can't we do this? And I think it stimulates not only the people here, but it stimulates the students, and it brings out the best in both sides. It makes our institution better, it makes our administrative staff better, it makes all of us have this sense of pride about what we've been able to accomplish by bringing in these young people and developing them along the way. We're a family here, and we're also part of a larger community. And the community itself is a wonderful place to raise a family, to work, to live, to play. And when you come to St. Luke's, our culture embraces all people, all backgrounds, and it's a nurturing culture. And I believe you can fulfill your potential to the maximum when you come to an organization like St. Luke's.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being with us tonight and providing us with questions, which we'll get to later in the show. Joining me is an important panel of medical professionals, Dr. J.P. Orlando, Dr. Andrew Goodbread, and Dr. Heather Crossa. We've started a conversation to discuss how St. Luke's is training tomorrow's medical professionals and what they've been doing. We're getting a little understanding of graduate medical education and what that means, but I'd like to dig a little bit deeper. So JP, I'm going to start with you. What is graduate medical education? And I know there are over 30 programs at St. Luke's, but explain to us what it is.
So graduate medical education is one part of the continuum for making a physician. And so if you are in college, if you're an undergrad, you decide that, hey, at some point I'd like to get into medical school. So you do 4 years of undergrad, and then you go into the medical school process, which is 4 years.
Which seems long enough. Now you've been training this long, and yet we still go on.
Yes, exactly,
Okay.
and you still go on. And so probably about the third or fourth year of medical school, you have a sense of what specialty in medicine you want to pursue. And so that specialty can be anywhere from 3 to 5 years. You can either decide to stop and be an attending, or you can go on to do fellowship. You could subspecialize.
So that's a lot of years of training. And
Lots
St.
of
Luke's
years,
is offering really now all of those layers, certainly not undergrad, but everything from that on.
Right. And so within that continuum, one of the things, like one of the trends is, so how do we care for that physician through that whole process? And holistically thinking, how do we care for that spouse? How do we care for the people around that physician going through training? And so we have spousal support programs in place. We have different activities to engage the residents and the family members, different benefits like free gym membership.
And of course, that helps with retention. So, Dr. Goodbread, you did your residency at St. Luke's, and they were able to keep you or retain you, and that was an important part of the process, because now you're here, teaching, giving back, working. So tell me what a residency is, and why was it so important to have all of these other support pieces in place?
Yeah, so residency really is that very focused time after medical school, right? So you have your 4 years of undergrad, then you have your 4 years of medical school, which lays the foundation for your medical knowledge. And then your residency is where you spend some time really focusing on the type of physician that you've decided you want to become. So for myself, it was, what are the pieces that need to be put in place to become the best family doctor? And so when I was looking for a program, I was looking for the one that would provide all of those foundational blocks that would let me be the best possible family doc. And for me, that was St. Luke's. And so a big part of that, in addition to the foundational components that are curricular, is, well, what are those supporting pieces, as Dr. Orlando mentioned, which are, what type of support is my wife going to have? If we decide we're going to start our family during residency, how's that going to go? Is that going to be welcomed at our program? In addition, what are the important things to the network that go into the benefits packages that would support us both as a family and then myself as a physician? So those were all the things that came into play for me when I was looking for a program.
That's great. Well, we're certainly glad that you stayed.
As am I.
Dr. Crossa, why is this additional training important? You're really kind of at the end of this training. You know, you go to medical school, you think, well, that person's now a doctor. Why can't they just start practicing medicine? Why is this additional training important?
So during medical school, you do get that foundation of knowledge, everything from the books, but as we know, people's bodies don't really read the books. Things happen a lot differently than they do in a textbook, so you really need that additional training and hands-on experience with somebody who's had a lot more experience clinically above you to help guide you and kind of fine-tune your process.
Very insightful information from all of our panelists, but we're not done yet. After the break, we'll learn more about the role of history and technology in the teaching process. You're watching St. Luke's Health Now. Stay tuned.
St. Luke's has had an affiliation with Temple University School of Medicine going back over 60 years, with students coming up here for clinical rotations such as surgery, internal medicine, pediatrics. 12 years ago, we became a clinical campus for 16 third year and 16 fourth year students who moved up to the Valley and took all their required clinical rotations. But we decided we needed to do more, and that led to the regional medical school between Temple University School of Medicine and St. Luke's University Health Network. We started off with 30 students, and now we have 120 students in the school, and our faculty has grown since we started. You know, seeing the school develop, seeing the initial planning until seeing the students graduate, I'm a proud papa. What can I say? They're all my kids, and I shouldn't say that because they're adults, but that's how I feel. I want the best for them, and I see them developing, and every day it makes me happy to come to work.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a really interesting show tonight. We're talking about training tomorrow's doctors. There's an expected shortage of doctors by 2030, and that is going to affect all of us. But St. Luke's is tackling the problem head-on. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. J.P. Orlando, Dr. Andrew Goodbread, and Dr. Heather Crossa. Thank you all for being here. All right, so we've learned a little bit about what graduate medical education is, what a residency program is, but let's talk a little bit more about what goes into these programs. Dr. Crossa, how would you describe the support that you've gotten from the administration and all the staff at St. Luke's to make these residency and fellowship programs successful in your eyes?
So I think a lot of people don't realize, and I didn't before starting residency, all of the work by the administration, by the support staff, by the attendings and directors that goes into training a resident. And then every step of the way, things kind of change, and they're very individualized. So that's one of the great things about St. Luke's, is that the teams in the administration look at each person, each resident, and each department as an individual and see and try and meet their needs specifically so that people can be the best that they're going to be in that program.
And, you know, Dr. Goodbread, as these programs have expanded, we are seeing a change and additional programs being added. So tell me a little bit about the type of residencies that are being added at St. Luke's and your role in that.
Sure. So, our network has a long history, which we've discussed, of training residents, training medical professionals across the board, and our other campuses have done a phenomenal job. I think the fact that we recently built our Anderson campus on 550 acres of beautiful space is just inviting us to create new programs to serve a new community and to expand on programs that we already have. So I'll personally be involved in helping to start a new family medicine residency at the Anderson campus, which I'm extremely excited about. Well, we're also going to be starting a psychiatry residency there, a new internal medicine residency, among others, some subspecialty residencies as well that we haven't had on our network and will be new to the region.
So it's exciting. You're really learning firsthand what we were just talking about with Dr. Crossa, which is that going starting from the very beginning and all the pieces of the puzzle that go into an expansion.
Yeah, absolutely.
That's great. Well, Dr. Orlando, it's not just the people that make the program, it is also the technology that goes into it. And you've got some pretty cool gadgets over at the St. Luke's Medical School that I would imagine are also used for graduate medical education. Tell us about that.
Yeah, so we are very much of a high-tech place. We're also a high-touch place. So what that means is simulation. So we have state-of-the-art simulators for our, not just medical students, but for our residencies. But we also work on that patient experience with the residents. So everybody goes through an initial ropes course, resident onboarding to the patient experience. And so we make sure that we keep that customer service piece front and forward, because the last thing we want is all that high tech to get in the way. I mean, we're a strategic partner with GE, and so making sure that we have the high tech piece in there is really important.
Dr. Goodbread, you know, the training at St. Luke's is unique, and you've mentioned that personalized medicine approach. How do you think it differs from sort of big city medicine?
Sure. I think a lot of it comes from the fact that St. Luke's was a community hospital, and still, in terms of the way it feels, it very much still is a community hospital in terms of the focus is on the interaction between the physician and the patient. So no matter how big we get, no matter how many campuses, no matter how many programs, the focus will be on what's happening in that room between the patient and the physician.
And that is so important to have that piece of the patient remain first and foremost in medicine. Dr. Crossa, as part of that, St. Luke's has so many really engaging community initiatives. Can you tell me a little bit about how yourself, the medical students, and other residents get to engage in some community activity?
So we go into a lot of health fairs, so we get to have one-on-one experience with a lot of the patients. We work in a lot of underserved and underprivileged areas, so we have the opportunity to reach out and work with people who wouldn't have any other exposure to the medical field or any other resources in medicine. And it's just great that we get to have that time with them. We're not limited by timers or how many patients we have to see a day, and everything really is just about being there for that person in that moment and making sure that they have everything that they need, just as they would in any other large health system, but making sure that they know that we care about them and we want to treat them like we would treat our own family.
It's truly a wonderful personalized approach to medicine. Thank you all so much. This has been a great conversation, and up next we're going to have questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our great panelists here. We have learned so much about graduate medical education, the medical school, and all the opportunities available at St. Luke's. So now we're going to take some questions. We had viewers send us some questions, and here we go. All right, so this is for all three of you. Anybody can jump in. What advice do you have for high school students who are considering a career in medicine?
Exposure, I think, would be really important. So if you have the chance, I know Moravian College and some of the other colleges offer times for people who are interested in medicine to shadow physicians at the hospital. Most of the physicians at our hospital are very open and will make tons of time for people who are interested in it to meet with them, talk to them, coach them, and just show them exposure and what our day-to-day life is.
We also have a mini medical school program, so people can request to get into that program, which includes education about medical school, also shadowing experiences as well, in different fields that they want. So definitely the shadowing opportunities are really good for an application to medical school.
And something that I tell people all the time is spend a lot of time learning about things that aren't science and medicine, right? Because when it comes time to apply to medical school and just to be a physician, your well-roundedness, your knowledge of things that aren't exactly what you're doing at the time will help you to bond with patients. It will help you to just be a more well-rounded individual overall.
It's amazing how often those interpersonal skills come into play. And I think as Dr. Crossa said earlier in the show, it's not just about what you learn in the books, but it's so much more than that and what you learn from your experiences in life. So excellent, good. All right, this is another great question we've got. How does being a teaching hospital affect patient care?
So this has been written about quite widely. If you look at the Association for American Medical Colleges, you go to their website and you can see all the different benefits and studies that have been done about how teaching hospitals compared to non-teaching hospitals when it comes to outcomes. So one of the drivers of that is the learning environment, and that when you have youth there, when you have young learners there, and they're with their faculty members, there is a dynamism that happens that is very engaging, and like we were talking about earlier, kind of keeps people on their toes. So, so the student will ask a very interesting question to a faculty member, and faculty, well, go take a look up, and while that's happening, the faculty member will also look it up. We all learn together in groups. Small group learning is really big in teaching hospitals, and it just rises the tide for everybody.
What about you guys, from your experiences having both been residents at St. Luke's, from your perspective, how is it for patient care?
Sure. One of the things I think that stands out is when you're learning medicine and now teaching medicine, you have to be up to date. Right, so typically board recertification cycles are 5-10 years, so you can get pretty far behind if you're not keeping yourself up to date. When you're teaching and learning medicine, you'd best be up to date to be able to teach it and learn it at the time. So my own parents have remarked about the fact that when they've come to our hospitals at St. Luke's, they have felt that the physicians that have taken care of them have been the most up-to-date physicians that they've been served by. So I think that stands out for a teaching hospital.
That's excellent. Really makes a positive impact for the patients. What about you, Dr. Krasa?
I think it gives extra sets of eyes, and everybody sees things differently, kind of through a different lens. So you get a lot of different angles on how people are approaching the same problem, the same disease process, and it's more layers of thought process that goes into it. So not only do you have a medical student, somebody shadowing, an intern, the senior resident, and the attending looking at them, everybody's bringing a different angle, and it adds a lot of value to the patient care.
All right, the last question is going to come from me, which is, what would you like viewers out there to know about the medical school and the graduate medical education programs at St. Luke's that you feel they may not already know?
I think that we are growing very purposely to respond to our community health needs assessment report, to help with hedge the physician shortage that is in process and coming, and that is very focused on the patient.
Great. Dr. Goodbread?
Sure, I think the most important thing is just that whatever type of physician you could see yourself being, if you're either a blossoming physician or thinking about it, is that we do a very good job of individualizing the education to help an individual become the exact physician that they hope to be.
Excellent, very personalized. Dr. Krasa?
I think as the network grows, it's important for patients to know that we're expanding into their communities and we're paying attention one-on-one. So even though our programs are getting a lot larger, we are absolutely continuing to focus on that patient in that moment, and that's something that's just built into the fabric of St. Luke's.
Excellent for people to know. Thank you so much, all of you, for being here and telling us a little bit more about how St. Luke's is helping our community every single day. For more information on training tomorrow's doctors at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.